So in the Overcome study, we analyzed data from more than 8,000 respondents who both met criteria for migraine and had 4 or more headache days in the preceding month. So this is a sample of active migraine, where someone's having on average 1 migraine or headache day a week. So this is a pretty active sample. The good news from these results is that 60% of them reported that they had sought medical care for their migraine or severe headache in the past year, which is a higher number than we had seen in earlier estimates from some of our other large, long observational studies. So that's a good thing. However, about 45% had sought care from primary care, which is not surprising. We usually think that the overwhelming majority of people who do seek medical care for migraine are going to start with primary care. And there are a lot of people who can have their care needs met very well in primary care, including lifestyle and educational initiatives, acute treatments, and preventive treatments. Those can all be covered for a large percentage of people with migraine very well in primary care. And considering we have 40 million Americans with migraine, we really do need a large healthcare force to care for them. However, there is a subset of people who are going to need specialty care, including either neurology care or even headache expert or headache center type of care. Those are probably going to be folks who have not gotten good outcomes from their acute or their preventive medications. Maybe they have contraindications, for example, to the triptans, cardiac contraindications. Maybe they have not done well with traditional preventives, either due to efficacy or tolerability and side effects. Or perhaps, in addition to being refractory, they have some comorbidities which make challenging management, like depression, anxiety. I already mentioned cardiovascular comorbidities. Those can certainly require a little bit more time, attention, and nuanced care that you're going to get in neurology care versus a primary care setting where time is so very limited, and often people are talking about multiple medical problems in one very short visit. So we were happy to see that the majority of our sample had talked to a healthcare professional about migraine or severe headache in the past year. However, a pretty large percentage, or a fair percentage, were using the emergency department as their primary care location for migraine, and we find that that's problematic for a number of reasons. You are probably not going to get the in-depth treatment. You're probably not going to have time for the education, really assessment of the need for preventive therapy, assessing whether acute therapy is optimized, and you certainly don't have the follow-up. So this is not the optimal location for migraine care. We'd like to see someone either managed well in primary care or moving up to neurology specialty care.